Good evening and welcome to Doctors on Call. They say the eyes are the windows to the soul and that seeing is believing. Tonight we're talking about eye problems. What would you like to know about the diagnosis and treatment of eye problems like glaucoma, cataracts, dry eyes, conjunctivitis? I'm Dr. Ruth Westra from the Department of Family Medicine and Biobehavioral Health at the University of Minnesota Medical School, Duluth, and we have a great medical panel ready to take your questions tonight. I'm pleased to welcome Dr. Grishma Bharucha, an ophthalmologist with Essentia Health, Dr. Lisa Graham, an ophthalmologist with Relf EyeCare Specialists, and Dr. Kevin Treacy, an ophthalmologist with St. Luke's Ophthalmology Associates. We have medical students answering our phones tonight, Kristen Heslip from Owatonna, Minnesota, Luke Logering from Crookston, and Seth Nelson is from Spicer, Minnesota. We're ready for your calls at 218-788-2844 or toll free at 1-877-307-8762. And now on to tonight's program. So we're very fortunate because we have some props, and Dr. Treacy has brought an eyeball, and maybe you can walk through the eyeball and tell us the different parts and what we're going to talk about tonight.
All right, I'll be glad to. So there are models of the eye which can help understand the eye and how it works. It's a fascinating organ, and what happens is basically as light approaches the eye, it enters through the cornea, which is the front window, and then it goes through the lens. And these two elements, the cornea and the lens, are the primary ways of bringing the light into focus on the retina, which is where the light signals are received and turned into electrical signals, and those are passed on through this structure called the optic nerve to the brain, where the electric signals are converted into our perception, and all of a sudden we can see things if everything is working well. And unfortunately, problems can develop anywhere from the very front of the eye to the very back of the brain that can affect vision. And so that's what we try to do, is help people maintain good vision by keeping things healthy.
Oh, thank you. Very helpful. Dr. Bharucha, I know you do corneal work.
Yes.
Maybe you can describe when someone would potentially have like a corneal transplant?
Sure. So there's many different types of corneal transplant. One would be the full thickness cornea transplant, which is done for conditions like keratoconus, which is abnormal shape of the cornea. There are also newer partial thickness cornea transplants, which can be done for conditions like Fuchs dystrophy or swelling in the eye after cataract surgery. So there's a whole wide variety of cornea transplants that can be done to help improve vision for folks who can't get better vision through glasses or contact lenses.
Oh, that's really helpful. The other thing people ask a lot, Dr. Graham, is macular degeneration, wet, dry.
Wet, dry.
Maybe talk a little bit about that too.
Macular degeneration is very common. Estimated that 1 in 4 people over the age of 50 may have some macular degeneration. Most macular degeneration starts as the dry type. It's just an aging change in the retina in the back of the eye. And there's a portion of the retina called the macula, which provides the finest, most detailed vision for your eyesight. First, you get little deposits in the retina, then you can get thinning, and sometimes it gets so thin that you get leaky spots, and then that we call wet macular degeneration. So it's sort of a progression. Unfortunately, wet macular degeneration can cause sort of sudden and severe loss of vision, especially if it isn't treated. Fortunately, there are treatments available for it, though. When I started, we had no treatments, and people routinely got a big blind spot from wet macular degeneration. But nowadays, they can see retina specialists and have medications injected into the eye that can help prolong eyesight and prevent serious vision loss. So, and there's lots of research going on with macular degeneration, so hopefully there'll be even more treatments on the horizon.
Very helpful. So we're kind of hitting the big ones here, Dr. Treacy. How about cataracts? How do we know when it's time to have a cataract surgery?
Well, that's a good question. Typically, well, there are occasionally situations where patients aren't aware that they have cataract because they're a very slow onset. And sometimes patients are being told and are surprised during an exam to hear that they have cataract. But that doesn't necessarily mean they need surgery, and I think most surgeons feel that they don't want to do surgery unless those cataracts are causing symptoms, trouble with activities of daily living, trouble doing things people need to do or want to do. And then if that seems to be the primary reason for the vision loss affecting their activities, cataract surgery is a wonderful procedure.
But you did, Dr. Bharucha, talk about potential side effects from having cataracts surgeries completed. Can you talk about that a little bit?
Well, cataract surgery in general is, quite a safe procedure, but as with any surgery, there can be risk like infection, inflammation, high-low eye pressure. But in general, it's a very safe surgery, and often patients recover within a month.
Oh, thank you. Dr. Graham, I have some questions are coming in now. And this is a question about age limit to qualify for LASIK. Do we have an age limit?
There are FDA recommendations. The main criterion is that your prescription be stable. And when you're young, you're growing and your eyesight changes, your prescription often changes. You should be, the FDA recommends that you be age 21 before you have LASIK, but I've done LASIK or PRK, a close cousin to LASIK, on younger patients if I have nice documentation that they've been stable for years. I think 2 years minimum stable prescription before you have any refractive surgery.
And the reason we'd have LASIK surgery, maybe talk about that a little bit.
Well, yeah, LASIK and other refractive procedures are to correct your eyesight so that you are less dependent on glasses and contacts. So it's people who just want freedom from glasses and contacts. It's a completely elective procedure.
Okay. Dr. Treacy, how often should I see my eye doctor?
Well, that's a good question, and part of it depends on age. In general, there's going to be screening going on even without an ophthalmologist with the family physicians and primary care doctors at the time of birth, and throughout childhood there'll be vision screening as people start to get near kindergarten. And I think in general the medical community is aware that if there are any problems, kids should get plugged in for a full eye exam to see if they need glasses, and certainly if there's other concerns like eyes deviating in or out, or trouble with depth perception. It's good to get a baseline exam. And then if the eyes are healthy and the refractions are not changing and the vision remains stable, people can go several years. And typically I would say getting an exam entering high school, and if things are stable, maybe early adulthood. But one could go 4 or 5 years. But then after age 40, things like glaucoma and other conditions come along. So there, I would say every 3 years, and then after age 65, every 2 years. But if a person's got a family history of glaucoma, certain racial risk factors, they might need to be seen more often. And at any point along the routine exams, if problems are found, that might be a reason they are seen more often.
Very helpful. Dr. Bharucha, someone is asking about pinguecula, with the cornea, and they're getting some cloudiness to their vision. Can you talk a little bit about that, and then what they can do for that?
Sure. Pinguecula is a growth on the conjunctiva, which is the clear lining on the eye. We call it pinguecula when it's limited to the conjunctiva, but if it starts to grow over the cornea, we call it a pterygium. Usually the symptoms of a pinguecula would be redness, irritation, but a pterygium, when it grows over the cornea, is when you can have a drop in vision. And usually, we try conservative treatment like lubrication, eye drops to help irritation symptoms, but once you develop a pterygium and it's affecting vision, we can offer surgery to correct that.
Excellent. Dr. Graham, there's a lot of questions coming in, so I'll try and do a little rapid fire here. So can I remove floaters from my eyes?
Yes and no. Floaters are normal, so I try to encourage patients to just get used to their floaters and kind of learn to live with them. It's the vitreous gel in the back of the eye just breaks down as we get older, and you start to see little specks and dots in your vision. Eventually the gel comes loose from the back wall of the eye, and you can get a big floater that's even more annoying when that happens. But again, they're normal as long as there's nothing serious wrong with the retina or inflammation in the eye. So it's good to have a good eye exam to rule out bad floaters, but most floaters are normal. People are very bothered by them, and I try to discourage them from having surgery, and I think most retina specialists, the person who would do the surgery, would discourage them because the risks are too great with that kind of surgery. There's also a laser to sort of try to break up floaters, and that has had some success too.
Oh, thank you. Dr. Treacy, caller asking about watery eyes. What can you do for watery eyes?
Okay, that is another very common problem. And we try to sort out, is it watery because of increased tear production, such as some sort of irritation, inflammation, or is it due to decreased outflow, normal tear production but reduced outflow, in which case we have to try to sort out, is it right at the opening into the drainage system, which might be easily treated right there in the office by stretching and enlarging the passageways. But if it's further on into the passageways, into the nose, and people are getting infection, and that usually would require surgery to drill a hole through the bone of the nose to allow the tears to drain. So it all comes down to what the exam findings are, what might be offered.
Sure, how much it bothers the patient too.
Mm-hmm.
Dr. Bharucha, this is an interesting question. Someone from Cloquet asking about there's different types of corneal transplants.
Mm-hmm.
DSAEK,
Mm-hmm.
okay, or DMEK.
Yes.
Difference?
Yeah, absolutely.
Very
So
good question.
DSAEK is the older type of partial transplant. This transplant has been around for about 20 years, and it's got more thickness than the other kind of partial transplant, DMEK.
Mm-hmm.
The DMEK tissue is quite thin, 10 to 20 microns, and it tends to scroll and behave differently in the eye, but both are excellent options to improve vision. The recovery is a little bit faster with DMEK. Okay. With both kinds of surgery, it involves injecting an air bubble in the eye to help the graft stick. And with DMEK, you get good vision after a week or two. With DSAEK, it can take 1 or 2 months, so a little bit longer recovery. But both surgeries are great options.
Very helpful. So chalazion, Dr. Graham, can you tell us any different treatments, what it is, and then how we would treat it?
A chalazion is commonly referred to as a sty. It is a bump on the eyelid. Usually when it starts, it's kind of red and sore and swollen, and it looks like an infection. But oftentimes it's just a plugged oil gland, and if you just heat up the eyelid, do frequent warm compresses, you can often get that oil gland to drain and the inflammation to go down. Sometimes if patients are getting worse, maybe there is an infection and we'll treat with antibiotics, but usually just warm compresses, and the sooner you start the warm compresses and the more often you do them, the better. If it does not go away with those conventional measures, we can do in-office procedure to drain the sty or the chalazion.
Mm-hmm. Dr. Treacy, a caller from Proctor asking about migraines in the eye, or can we get an aura before migraines?
Mm-hmm. Yeah, it's actually a complicated condition, and people can develop temporary visual disturbances that can be quite bothersome. It can involve one eye or both eyes. It can be associated with headaches or just the visual changes. And after a while, patients come to recognize a typical pattern, and they're sort of less concerned because they know this is going to run its course and clear. But initially, we are trying to sort out, could the light sensations that they're noticing be due to something besides migraine, which even the cause of that is not certain, but it could be some spasm of the blood vessels that will reverse. On the other hand, there can be other sources of light flashes involving traction on the retina that could indicate a retinal detachment. So I think the best thing to do is err on the side of having it evaluated at the time that it's been seeming to occur, the onset, and then try to sort out if it's running a typical pattern, then I'd say ride them out.
Dr. Graham, a caller asking about difference between bacterial and viral conjunctivitis. Do we do different treatments for those?
Yes. So the conjunctiva, as we already learned, is the clear covering over the white of your eye. Anytime it's inflamed, and usually it makes it sort of red and puffy and irritated, we call it conjunctivitis. And conjunctivitis has lots of different causes. Allergy can be one, infection can be one, dry eyes causes inflammation of the conjunctiva. Infection, we separate into different sources, like viral or bacterial are the two most common. Viruses, as you may know, you can't treat with antibiotics. You just have to, like a common cold, you have to let it run its course. You can provide comfort measures that can make you more comfortable and help, ease the pain, so to speak. But it just has to basically run its course. Whereas a bacterial one usually has more discharge, more goopiness, and you can treat that with antibiotics. But unfortunately nowadays I think we overuse antibiotics. A lot of conjunctivitis is just viral, and you just got to let it run its course.
Mm-hmm. Very good. So then a caller now, Dr. Bharucha, from Ashland, asking about if after trauma, if you have some blurry vision and you can sometimes develop like a little membrane, what do you do about that?
Trauma can cause a lot of, problems in the eye. Sometimes you can get something called a hypema, which is blood cells floating in the front of the eye. I'm not completely sure what the caller means by the wrinkle.
Right, so kind of an epithelial membrane or something they were describing. So
okay. There is something called recurrent erosion.
Mm-hmm.
So if someone has a fingernail injury to the eye, to the cornea, they can be susceptible to the surface cells of the cornea being able to rub off easily when you blink or in the middle of the night.
Mm-hmm.
So if it becomes a big problem, we can try hypertonic saline eye drops. In bad cases, we may recommend a corneal scraping or a laser to prevent this recurrent erosion syndrome.
Thank you, very helpful. So Dr. Treacy, a caller asking about glaucoma and the pressures. What is the pressure necessary for a diagnosis of glaucoma?
Okay, well, I'd say in the olden days, we thought people with high pressure had glaucoma, and that would be statistically a pressure over 21. What we've learned is many cases of glaucoma never have elevated pressure. So the glaucoma diagnosis is actually based more on the appearance of the optic nerve. Is there any evidence of damage going on? Because that particular eye doesn't even tolerate a normal pressure. But there are some telltale signs of glaucoma damage, which routine eye exams can pick up, and then more testing can be done, and a decision then needs to be made. Do we need to lower the pressure? And so,
Dr. Graham, a caller from Hibbing, asking about diagnosed with prediabetes, and what do we look at? What does an eye doctor look for when they're coming in to do a diabetic exam?
So when you have diabetes, it's recommended that you have an eye exam every year. With pre-diabetes, maybe not as critical, but still probably wise to have an exam every year. Diabetes can affect the circulation in the retina, and you can see weakening of the blood vessels, you can see leakage of the blood vessels, fluid buildup in the retina, and sometimes the circulation just kind of gives out, and there's areas that aren't getting good circulation that start to sprout new blood vessels, and those can be very damaging to the vision and cause all kinds of problems. So that's what we're looking for when we dilate the eyes of a diabetic and look at the retina.
Very helpful. A caller from Duluth, Dr. Bharucha, asking about dry eyes. Anything that we would do for dry eyes?
Yeah, dry eye is complex. Your tears, they're made up of three main components: the oily or lipid layer, the middle water layer, and then an inner mucus layer that helps spread the tears. So you need the right balance of all those three components. And if they're not in balance, people can have dry eye syndrome. So there's different recommendations based on what component is missing in the tears. If you don't make enough oil, we may recommend things like warm compresses, eyelid massage, omega-3 fatty acid supplements, and then of course to supplement the water layer of tears, artificial tears, lubricating eye drops. In bad cases, we can put plugs in the tear ducts so that more of the moisture spreads on the surface of the eye. And there's also prescription eye drops to help increase your tear production as well. So there's quite a variety of treatment options for dry eye.
And lots of over-the-counter
Yeah.
preparations that people use before they even come to the eye
Absolutely.
doctor. Yeah, absolutely. So Dr. Treacy, a caller asking about color changes of the iris. And with age, is there a color change or something that you notice?
Well, if you're looking at someone as they get older, there can seem to be some decrease in color, which actually can be some lipid deposits in the cornea called corneal arcus. But in terms of the iris itself changing color, there are conditions, tumors, new blood vessels, trauma that can change the appearance of the eye. And usually with the magnification that we have with our equipment, we can try to sort out what the cause is.
Very good. Dr. Graham, a lightning caller from Wisconsin asking about lightning bolt in the right eye or a sense of flashing in the right eye.
Yeah, flashes or what we call photopsias are kind of common. I think an occasional one is kind of normal, but if you're having a lot of flashes in your vision, we worry about retina issues. So it's good to have the eyes dilated, a good look at the retina. We worry about tears in the retina, and that tear in the retina can lead to a detachment of the retina, and you can suffer serious vision loss if a retinal detachment's not kind of caught quickly and managed properly.
Dr. Bharucha, a caller asking about supplements. I know I often see vitamin supplements, perhaps for macular degeneration, but are there other supplements that patients should use?
Supplements are mainly recommended if you've got a certain level of macular degeneration. That's where most of the research and studies have been done on. In general, eating leafy green vegetables, is good for the eyes.
I'm looking for one that's fairly rapid because we don't have very much time left. That one's a little complicated. Maybe describe Keratoconus, Dr. Graham, shortly, or
Correct me.
because we talked about that a little bit.
So keratoconus, it usually affects young adolescents. Some of it is hereditary. It can be associated with eye rubbing or allergy. And basically, instead of being round, the shape of the cornea, it tends to bow out. And this can cause a lot of astigmatism, can cause scarring in the cornea. And we try to correct vision with glasses and special contact lenses, but in very severe cases, that might lead to transplant. There is a new technology called corneal collagen cross-linking. So if keratoconus is caught early enough, this treatment can help stabilize the cornea so it doesn't progress.
Well, that was really helpful. So maybe we'll end this with Dr. Treacy and give us some advice for prevention so that we don't get eye injuries.
Oh boy.
Rapidly.
All right. Yeah.
10 seconds.
Just remember, metal on metal is the worst. And I've seen people putting hockey rinks up. This is the time of year, pounding away with a sledgehammer. Make sure you have protection on.
Bungee cords, paintballs.
Yeah.
What else?
A whole litany of injuries.
Fish
Be-
hooks.
Fish hooks.
Yeah, just be aware that the eye
Hunting season.
are important and they're easily damaged. by projectile objects. Yeah.
So eyeglasses, safety glasses,
Mm-hmm.
your own eyeglasses that you wear at all times.
Absolutely.
And when you're using under cars or with metal flying, some kind of protection.
Mowing the yard. You know,
Yep.
rocks can shoot up and hit the eye. So.
Hammering.
Care and caution. Well, I want to thank our panelists, Dr. Grishma Bharucha, Dr. Lisa Graham, and Dr. Kevin Treacy, and our medical student volunteers, Kristen Heslip, Lou Lockering, and Seth Nelson. We're off for the next 2 weeks due to the Thanksgiving and Pledge Week here at WDSE WRPT. Please join Dr. Ray Christensen on December 7th for a program on stroke and other neurological problems, when his panelists will be Dr. Rachel Gordon, Dr. Amy Greminger, and Dr. Vikram Jadhav. Thank you for watching. Good night.